Good morning. Myself, Dr. S. Mohammed Akram Ali, Assistant Professor, Department of Pharmacy Practice, Ishanma College of Pharmacy. So today we're going to see about myocardial infractions surgical procedure. Already we discussed the myocardial infractions introduction, types, signs and symptoms, etiology, diagnosis, pathophysiology, and pharmacological treatment. Today we're gonna see about the surgical procedure. So before getting into the topic, first of all, we go through the overview of myocardial infraction. So myocardial infarction is the blockage of blood supply to the heart that leads to irreversible cell injury, cell death. So it is also called as an heart attack. So before we discussed the pharmacological treatment, so now we're gonna see the surgical procedures. So what are the surgery are underwent when patient affected by myocardial infarction? So first one was coronary angioplasty. So it's the most common procedure to open up the blocked arterial. A catheter will with a tiny balloon at the end is introduced into the artery and inflated. So these are the diagram represents the procedure. So these are the stenting procedures. Stent with balloon angioplasty, then it will based on the blockage side. So in the left hand side we can see the blocking of the blood supply, and in the second image, stent with balloon inserted into partial blocked artery, and the third image the balloon inflated to extend stent, then the balloon fourth one was balloon removed from the extended stent. So these are the steps involved in the angioplasty. So second one was stenting. A small metal mesh tube is placed in the blocked artery to keep it open. So first one was with the balloon, and second one was stenting. Stenting is nothing but metal that does not affect your body. It replaces the tissues also. So in right hand side we can see the metal mesh. So it's the another surgical procedure for myocardial infarction. So first one was balloon and second one was stenting. It's a metal like tube that placed in the blocked area. Then third one was coronary artery bypass grafting. This is commonly called as an open heart surgery, a surgical technique where the blocked or narrowed artery is bypassed during using a healthy vein or artery from another part of the body. It's nothing but the damaged artery was removed and it was replaced by the healthy one. Mainly they took from our legs. So it's the bypass grafting, is known as open heart surgery. The decision to perform surgery depends upon the severity of the myocardial infarction, the location and the extent of the blockage, and the patient overall health, individual factors. These are the criteria which has to be considered before the surgery performed. So it is important to note that the surgery is not always the first choice of treatment. A non-surgical intervention affects in many cases. So surgery only was not the cure. First they were gone for a pharmacological treatment. Once it not effective or the affected area may extend, then the physician suggests for surgeries. So these are the diagrammatic representation of open heart surgery, which is bypass graft. So first they will open our sternum and uh, replace the affected nerve, affected artery with the healthy nerve. So these are the diagrammic representation. Then the last one was non-pharmacological treatment. As we discussed, treatment was considered to be two types. One was pharmacological treatment and another one was non-pharmacological treatment. Pharmacological treatment was with the drug. So last video we see that drugs like aspirin, nitroglycerins, heparin, AC inhibitors, beta blockers, statins. So here the non-pharmacological treatment without drugs. Without drug means how the patient can prevent the disease without using drugs. So first one was lifestyle changes. So most of the disease can be controlled through this lifestyle modifications. So here the modification to lifestyle can help lower the risk of further heart attacks. These modifications could include giving up smoking, changes to a healthy diet, keep weight in check, engaging in regular physical activities, and learning stress management techniques. These are the lifestyle modification that can prevent further heart attacks. Then cardiac rehabilitation, a medical supervised program designed to speed up recovery and enhance health for those with heart problems. So during this procedures, patient not only by physically, they are also affected by mentally. So this rehabilitation can help the patient to overcome this stress. So it is usually consist of heart healing instructions, exercise trainings, and mental health and stress reduction counseling. So then next one was oxygen therapy. By raising the blood's oxygen content, supplemental oxygen therapy may help lessen heart muscle deterioration. So oxygen is the primary part, primary constituent for our body. So this also non-pharmacological therapy for myocardial infarction. So next one was therapeutic hypothermia. So after heart attack, this treatment that lowers your body temperature to below normal in an effort to lessen the risk of brain damage and other problems. Then acupuncture. So acupuncture is also the non-pharmacological treatment for myocardial infarction. According to some research, acupuncture may help a heart patient from their symptoms of chest pain and improve heart functions. So these are the non-pharmacological treatment. Finally, thank you.